Then another one is basically vitamin D. You know, so that's like if you live in America, in North America, everybody needs to be taking vitamin D. But we check the level, so we want to know like, do you need 2,000 or 5,000 or whatever, or even more than that.
Yeah.
You know, so
like my 300,000 I am.
Yeah, I know.
Yeah,
I know. Just recently.
That freaked me out, man. Yeah, so I just came for the longevity.
Oh my God.
Yeah, I was like, you're really gonna inject me 300,000 IUs of vitamin D? Afre Guam and beyond. This is Dr. Nguyen, the Longevity Doc. So I'm here in Thailand with Dr. Ken, one of my good friends for the last couple of years. We actually met in Virginia, my first job out of residency at Nova Medical Group. So it's a very integrative clinic. You know, we had acupuncturists, aesthetic medicine, different specialties, urgent care, family practice, a dietitian, nutritionist. So all sorts of things coming together in one practice, working together, integrating and helping our patients. So that's where we met, and we've been in contact for the last couple of years. And I'm finally here at his residence. You know, we showcased it earlier, but here staying with him in this lovely residence. But, you know, I thought it would be a good time to actually interview Dr. Ken. He's actually the first naturopath doctor I'll be interviewing. And, you know, I wanted to get his take on, you know, naturopathic medicine, some of his cases you've been through. So first off, Dr. Ken, thanks for having me here.
Oh, thank you for inviting me here.
Yeah, well, it's your place.
Oh, yeah. Thank you for
inviting you to your podcast, right?
Yeah.
Yeah. So, yeah. Could you tell me a little bit about your background? How do you become? Because I think not many people are familiar with naturopathic medicine or how to become there. So, what was your route to become a naturopathic doctor, and what kind of things do you do? How do you practice medicine?
Okay. So the basically I did my undergraduate at the Arizona State University.
Yeah.
For biochemistry, and you know, so I was kind of wanted to be a doctor, but then I didn't know what kind of doctor I want to be, and a friend of mine, he told me about naturopathic medicine and a naturopathic doctor. So, and apparently where I went to school in Arizona, there was a school there, southwest of College of Naturopathic Medicine. So I went to check it out, and then I went to shadow with some of the naturopathic doctors in the area, and I also shadowed some of the conventional doctors, conventional medical doctors as well. And then I see the difference because you know the conventional medicine is great. You know, it's very good for acute care. The naturopathic medicine is more like you know, like very good at chronic disease management and trying to find the root cause from what I was seeing back then, and using the natural remedies. But we, you know, they also learn how to use the conventional treatments as well. So with all that, so I was like, you know, oh, maybe this is the type of medicine that I want to practice. You know, I wanna try to improve people's health through natural means, and so that's why I decided to go to Bastion University. So it was, as far as the naturopathic school, there are not many. Okay, I went to the school in Seattle area called Bastion University. So it was a 4-year program, but I did a 5-year program because I did the Master of Science in Acupuncture as well.
Yeah.
So the basically the first 2 years we learn about, you know, all the ology classes, like, you know, physiology, you know, so all those the classes that we need to learn as a medical school, like your anatomy
classes.
Yeah, right? Yeah, all those science classes.
Yeah.
And then the
so a lot of the curriculum that
it's very
have
similar
in your first year or so in medical school.
Yeah,
right?
the first, basically we learned pretty much very similar to conventional medical school, you know, because we have to learn the conventional side, but we also have to learn like all the natural medicine side of it, like botanical medicine, you know, like, you know, physical medicine like hydrotherapy and all the even acupuncture, because I was doing the Master of Science in Acupuncture as well, like with traditional Chinese medicine. So we learned all that, even homeopathy and all those things too. So we have to get all those classes together along with the conventional treatments. So it's a 4 year to 5 year school time. The first 2 years basically in classes. The last 2 to 3 years basically in a clinical setting as well.
So you'll be seeing patients, just like
Yeah.
medical school, you're
Right.
treating patients,
And then-
consultation and things like that. Okay. So you went through naturopathic school, so that's a 4-year degree with your master of science in acupuncture, so you got that skill. So I guess take me through, maybe we'll go through some cases, but
Right.
generally speaking, you know, what would you say is the difference between the conventional medicine nowadays, let say family practice like me,
Right.
versus the approach of a naturopathic doctor? You know, can you go through that a little bit?
Yeah, so like the main difference, what I've seen so far is basically like as we train like as a naturopathic doctor, we're trained just like medical doctors, but we're trained to use natural remedies as a first line therapy.
Yeah.
And we're trying to find out the root cause of the problems, and we take a lot of time, talking with the patients. So all my patients, at least I need to talk with them for about an hour, to try to find out their, what's going on with them, their lifestyle, their sleep, their diet. I mean, you name it, like everything about the whole picture of it.
Yeah.
Before,
and that's a luxury in conventional medicine these days. Like having an hour with the patient, right? That's just unheard of these days.
Yeah,
like
that's true,
because
yes.
we're generally speaking in family practice, you're 15 to 20-minute slots.
Yep.
And really face to face, you have maybe 5 to 10 minutes because you have to account for vital signs checks and checking in the patient, all sorts of stuff. So really 5 to 10 minutes face to face time. So that's kind of nice to get a full hour if you need that, right?
And we need it,
And
that time.
if you're going through trying to find a root cause, a lot of it's going to be found in the history. I think nowadays I'm trying to put a little bit more of that, but you can't put that really in that system, because we have to also be able to run an overhead for a clinic. It's very expensive. So I think for us family medicine doctors, we can maybe streamline that with using a lot more questionnaires, so getting all that information up front. So the history taking doesn't necessarily take an hour. But yeah, go back to, I guess, the encounter, like you kind of go through the history, a full hour, like, and what's your kind of general approach, or what's kind of the mindset?
So I, in my clinical practice, what I do is like for initial visit, at least. So I break that down into 2 visits.
Okay.
So I call it part 1 and part 2. So part 1 is basically you're trying to get to know the patient. So the patient has to fill out the questionnaire as well online.
Yep.
And then I'll be going through that in detail with the patient, with all the lifestyle, the environmental factors and all those things. And then reviewing the past lab results if the patient has any of those with them. And then so I'll review those with them. And then and trying to come up with like the what other tests we need to run on the patients. So and we basically we'll bill all the insurance basically, all these tests, but it's a lot of tests, because a lot of my patients, they, the report that I get for part 2 visit, which is basically about a few weeks later. So I'm going to be going through all these results with the patient and then telling them what they need to do in terms of like their lifestyle and what if necessary, like what supplements, nutritional supplements, herbal medicine or whatever that they need to be taking. So so the so the lab results can take like, well, it can be like maybe almost 20 pages. And it takes about an hour, and I go like line by line, I go each one, because the patient doesn't know much about all these lab tests, and
you
they get
have to explain
confused.
that, because they're not your typical labs, right?
No, they're not typical labs, but some of them is typical, but most of them is like very comprehensive advanced laboratory tests that we do.
Okay.
So
now we kind of went through the process. I mean, it's very similar, but you have a little bit more time, and generally speaking, you probably order more labs. You probably get a lot of the conventional labs coming in. You request that, but then from there, based on the history, you order a lot more detailed labs. So a lot of times, in my case, they're not covered by insurance.
Right.
Some of them is going to be like gut testing, stool testing, organic acid testing, heavy metal testing, mycotoxins, so all sorts of stuff, we kind of mutually test for on the integrated medicine side and the functional med side. But maybe let's just so that people get an idea of how effective or what it looks like. It's more tangible if we talk case studies,
okay.
right?
All right, good.
So can you give me some maybe case studies of where maybe a patient came in, they'd done the conventional things, they saw maybe a family doctor like me, and didn't quite reach the goals or the symptom relief they're looking for. Yeah,
sure.
so can you give maybe a case?
So I have this case. He's like about 42-year-old male, coming in with like basically metabolic syndrome.
Yeah.
He has hypertension. He is obese.
Yeah.
He's about like almost 200 pounds, and he's like, he's only like maybe 5'6".
Yeah.
And then he has like blood sugar problem, kind of pre-diabetes type of things. Cholesterol is basically pretty bad, especially triglycerides and all those things.
Yeah.
So he's been to conventional medical doctors, and what he got was basically, oh, here's the statin.
Yeah.
Like you take it, and then but he took it, but it didn't work.
The LDL didn't come down.
The LDL came down,
okay.
but the triglycerides and obesity and like the fatigue too, and all these symptoms that he's been having, with the metabolic syndrome, even high blood pressure. He took the medicine, but it didn't work out very well. When he checked the blood pressure daily. So then he was like, he came to me. He was like, oh, what can I do? So I went over the part 1 visit with him, going over all the medical history, looking at his diet, his lifestyle, and all those things. And we ordered like very comprehensive lab tests, probably over 20 pages of lab tests. So we did the advanced lipid panels. We did like all the nutritional, like nutrients panel.
Okay.
We did like some type of checking for gluten sensitivity, celiac disease type of panel as well. And we found he has a little bit of sensitivity to gluten too.
Okay.
Like the gliadin antibodies was like, elevated, especially the IgG and a little bit of IgA, gliadin antibodies. So, so we talked about, and the blood sugar definitely high, all those things like in the pre-diabetic range, maybe about 110.
Yeah.
So and A1C was elevated definitely, in about like 6.1%.
Okay.
So anyway, so we did all the lab tests, plus I did like a little bit of some stool tests, like just to see his gut, like the malabsorption, probiotics, leaky gut type of things. I mean, he didn't have that much problem though in that area. But he has a whole bunch of nutritional deficiencies. Definitely like B vitamins deficiency, like including the homocysteine levels elevated, with the vitamin D, B vitamins, even coenzyme Q10, like certain vitamins like vitamin E, things like that. So
you had a whole nutritional, especially B vitamins. So you found that in the labs. What do you think caused? Because these days no one's necessarily undernutrition, malnourished, right?
Yes.
Maybe undernutrition, but not malnourished. But like, what do you think caused the low?
Some of the B's.
B's.
Okay. So actually, interestingly, so he went to see kind of like a dietitian type of things, and then they recommended like a plant-based diet. So he was like eating kind of plant-based diet, but I don't think it's a healthy plant-based, because he was eating a lot of processed like starches, like without like much protein. So he has some protein deficiency a little bit. There, like with the total proteins a little bit on the lower side, so like even below 6. So, but anyway, so he has some issues with that. And then so we fixed his his diet, his lifestyle, and then giving him some like nutritional supplements that he needs. And and actually within, I would say, in 3 months he already felt better, much better. With his energy levels, the weight has steadily coming down. The blood pressure has like somewhat stabilized in the first three months. And then 6 months though, like he could like just discontinue his medication. Like the
awesome.
And then the cholesterol actually normalized within 6 months, like especially with the LDL particle counts, even the small LDL, particles, which is the plaque builders. So
wow, that's
anyway.
awesome. So essentially, just to break it down, you changed up the diet. So I
Yeah,
imagine
just
like
a simple,
a
like,
gluten-free diet, maybe.
yeah,
or- Okay.
I told him to like kind of minimal. Now the gluten-free diet that I was telling him is because I want him to lose weight too.
Yeah.
But we want him to do like the like basically concentrate on the starchy vegetables, like healthy
Yeah.
starchy vegetables versus eating grains.
Yeah.
So I mean, I told him to eat like as far as the grain, even though it's not grain like quinoa, right? Quinoa is a seed of the plant. So I told him to, like, if you want to eat something kind of like a rice, so just eat like use quinoa instead.
Okay.
And
Of
then
like white, instead of like white
and then
rice or-
eating like more like a starchy vegetable in terms of like sweet potatoes,
Yep.
like squash, like like beets, rutabagas, like those type of foods, like pumpkins,
Yeah.
things like that. So I told him to do that for starch,
Yeah.
and then the lean protein, lean animal protein, because he didn't his protein was not great.
Yeah.
So we wanted to up his protein, and then tell him to eat no later than 7 p.m. too, because that's another part. He was eating late, like he was eating like 8 or 9 p.m. for dinner,
Okay.
which is not healthy at all, you
Right.
know. And so I have him like do like no later than 7 p.m. if
Yeah.
possible, and then so and then he was like doing the starches like that with the lean protein and the leafy vegetables,
Okay.
plenty and an unlimited amount of leafy vegetables
Right.
that he can eat.
Yeah. So some simple things like that.
Yeah,
Just
simple
change
thing
up
like
the
that.
diet.
And the
Maybe
supplements, right?
And the supplements kind of help boost that
Yeah.
process up, so your cells are optimized and functioning more optimally. But I think so. That's hopeful for like tons of people, right? Because there's so much metabolic syndrome out
Right.
there. But let's maybe go into more of the complex stuff, right?
Okay.
Because I could see that for doable. Maybe subscribe a keto diet, and I think just the weight loss in itself will help
Right.
with the metabolic syndrome.
Right.
But maybe the hard one is, I would say, autoimmune disease, right? Because
Autoimmune.
typically in conventional medicine, if you have some sort of autoimmune disease, whether it's like lupus or something, you're on like immunosuppressants. That's
Right,
kind of the
right,
general
right.
treatment plan, right? Prednisone or immunosuppressants, and I'm
Yep,
not a big
yep.
fan of that.
Right.
Like, are there any autoimmune cases that were a good
Yeah.
success story for you?
Maybe like autoimmune thyroid disease, like Hashimoto's.
Yeah.
I've seen some patients, like for example, this is like, I think she's a 47-year-old female, coming in with fatigue. She has Hashimoto's. Her anti-TPO probably like above 3,000 even.
Oh, okay, that's high.
But negative anti-thyroglobulin antibodies. And then she has like some nutritional deficiencies in general. We checked her B vitamins, B12 was low, B6 was low, and then like homocysteine was high, like above like 14. So and then her diet is not good, not that great. Okay, so what we, and stress, that's another thing too. So she has a lot of stress in her life. So so I kind of recommend her to manage stress through like there's a technique that they can do, like it's called the emotional freedom technique, EFT.
Okay.
So like using a little bit of acupuncture points to tap the certain points, and that helped her actually. And transcendental meditation, I kind of recommended her, and she actually did it, and it's amazing actually, along with other things that we do with the lifestyle change, diet, and supplements. So so we did about, I think, about 6 months. Her anti-TPO came down to probably in the hundreds, maybe like 300 or so.
Okay.
So from like thousands
Yeah.
down to 300. And then her thyroid, because she was on the thyroid medications like Synthroid,
Levothyroxine,
levothyroxine and all those things, it wasn't helping her.
Yeah.
Actually, like she was still like fatigued and gaining weight and all those things. But with the diet and supplements, we also gave her like some nutritional supplements, like simple ones like multivitamins that I usually recommend, like that has all the nutrients to support the thyroid function, like selenium, zinc, iodine, all those things. Yep. So that helped her a lot. So within 6 months, she felt so much better.
Yeah.
She's still on the same medication,
Yeah.
but later on, we found that the her T3 level seemed to be a little bit on the lower side. So I kind of recommend her to maybe do like some type of natural thyroid medication, like WP thyroid and all those things, and she did, and then she felt even better.
Like Armour thyroid?
Armour thyroid
like
too.
Thyroid
Yep.
T3?
Yeah,
Okay.
yep.
Okay.
They have some more T3.
Yeah. And oftentimes, like with Hashimoto's, sometimes if we're still working things up, I might recommend just if we're gonna fix diet, maybe just cut out gluten.
Yeah,
cut out
definitely.
dairy.
That's another thing. We did the
Like
autoimmune.
what percentage of people do you think of autoimmune thyroiditis benefit from being on like a dairy or gluten-free diet? Like
From my clinical experience,
Yeah.
yes, at least it calmed down the inflammation because we checked the CRP, cardiac C-reactive protein, and fibrinogen and some other things too, to see the inflammatory markers.
Yeah.
And it came down. And actually the TSH and everything else, they kind of normalized.
Yeah.
So I have them do if they can, because it's tough. Like autoimmune diet is like it's not easy.
Yeah.
But definitely like I recommend the patients to avoid the gluten, because that can trigger the autoimmune disease and make it worse, right? So I recommended her to do that, and then trying to be careful with some even beans, some other beans as well. So we did some actually this patient. So we did some like what is it, allergy panel?
Yeah.
Like IgE.
Food allergy.
Like we did the
Food sensitivity.
Yeah, actually the actual allergy, the IgE.
IgE. Okay.
Yeah, IgE, which can cause like leaky gut and all those things if you have allergy to them. So we did the comprehensive IgE food panel, from the like Thermo Fisher, like the IgE immunocap technology. So it's like the best type of IgE test. So we did like probably like 200 type of like foods panel, like so we did that, and then we found like she's kind of allergic to nuts, some seeds, some beans. So so I told her to just basically just avoid those foods as well, along with the with gluten.
Yeah.
And then the the antibodies, all those things came down, not like totally normal, but below 100 type of things, and she felt better too. And she doesn't have much inflammation. She was complaining about actually joint pain as well, like some type of pain too. So so that helped her. Like her brain fog is much better. Her gut, like as far as the digestive issues, much better as well. So
Okay. All right. So I'm gonna put you on the spot a little bit. Kind of.
Oh yeah, go ahead.
Maybe shoot out the criticism and you can kind of backfire or comment on it, right? I think a lot of the criticism naturopaths or functional med doctors get maybe from the conventional side is, we as traditional doctors prescribe medicines, but naturopaths might be almost doing the same thing, or because they're prescribing all these supplements,
Right.
50 list of supplements, right?
Right.
And they're making a lot of money off that.
Yeah.
Or it's just very expensive too, right?
Yep, I
to
totally
just
understand.
maintain that kind of list of supplements. I try to be more mindful and try to pick the best bang for your buck, because I also have a patient population. $200 in supplements is a lot of money.
Yes.
But like, what's your kind of counter to that? If you get that kind of maybe criticism.
Yeah. So, I get that a lot actually, because especially my, like the new patient, right? They're referred to me like by some friends, and they're like, oh, you know what? I like a lot of patients too. Like they're saying, oh, they're upfront, which is good. They're being honest, right? They say, oh, I don't have a lot of money. like I just want to, to take whatever I need to take, like and whatever, So like I told them upfront too, like. I only recommend the patients, only the necessary supplements, and we do the test because we want to know what you really need.
So the way you try to narrow it down is to test and make sure to be more precise about what exactly you need, so you're not wasting money on what might work, right?
Right. So we do, so like, so basically, so we do that, and I personally give like 20% discount for all my patients, at least 20% discount on the supplements that they buy anyway. So they get a pretty good like rate already for supplements, but also like the I told them upfront too. There are certain supplements that everybody needs to be taking. For example, like multivitamins, a good one.
Yeah.
Okay, a good multivitamins, a high quality professional brand like multivitamins, all natural stuff, like natural vitamins and minerals and all those things. No synthetic fillers and all those things. So that's number one. Number two is omega-3 fatty acids. You're never gonna get it much, like unless you eat like cold water fish like every single day.
Yeah.
And
I think almost everybody we test the
omega-3 index.
Omega-6 index is just not
it's just
optimal.
out of whack. Yeah, I know. So that's that's second one, right? Omega-3 fish oil, and then another one is basically vitamin D. So that's like if you live in America, in North America, everybody needs to be taking vitamin D. But we check the level, so we want to know, like, do you need 2,000 or 5,000 or whatever, or even more than that?
Yeah.
So
like my 300,000 I am.
I know, just recently.
That freaked me out, man. Yeah, so I just came for the longevity.
Oh my God.
Yeah, I was like, you're really gonna inject me 300,000? I use a vitamin D, but I just checked with them. It's like, oh, I should be okay.
Yeah, it's an IM.
Yeah. So, but anyways, yeah. So okay. So at least you test and prove that these are deficiencies that you need, so you're not just throwing out stuff.
Right. And we, like I said, that's why I need that hour, to explain to the patients.
Yeah.
I don't just like talk to them briefly. Hey, you need this, you need this, you need this, and then call it a day. No, because the patient's probably not happy with it.
Yeah.
They want explanation. So anyway, so that's why the patients are very happy.
Yeah.
So
can you comment on, the supplement industry is a big industry, right?
Mm-hmm.
But can you comment on, the differences between different brands, or, like, is there a big difference in clinical outcomes between getting an Amazon or GNC? I don't want to say the brand.
Yeah, right.
Like an inferior brand versus maybe the ones that we recommend, like Designs for Health, or there's a multiple that are higher quality, but do you see a big clinical outcome?
Huge difference. So I mean, I'm not trying to sell supplements here, okay, but I see a huge difference, like from over-the-counter brands. I'm not saying, I'm not mentioning any names, but personally, for the past, whatever 20 years of my clinical experience, I've used many different brands, but from my clinical experience, I see a consistent results with Designs for Health. So that's what I use mainly for that.
And have you seen like a difference where they were using some sort of over-the-counter, the same thing, and then you change it over to say Designs for Health, and then their levels shot up?
Right. And how they feel as well.
Okay.
The results definitely improve, like with the cholesterol panels, maybe the blood sugar, insulin resistance, all those things, all the markers are much better from what I've seen in my clinical experience with Designs for Health, compared to other brands on over the counter. Because we try, because the patients, right? They say, hey, I'm a member of this supplement companies, and I get a really huge discount. I kind of want to try this one first, like like their brand first.
Right.
So I said, yeah, go ahead. Like I'm not trying to sell you the supplements. It looks pretty much similar.
Yeah.
So I let you try it for 3 months, and then if it doesn't work, then you can come try our brand and see how it works.
Yeah.
And you see the huge difference.
Yeah.
And later on, they don't even go back to whatever that brand.
Right.
So I mean, yes, it's unfortunately there's a difference between the brands stuff. Yes.
Awesome. Yeah, I just want to get that out there too, coming from a naturopathic doctor that does see a lot of clinical results with different nutritional supplements. Last thing I wanted to go was, how do people find you? What's your website?
You can go to my website, www.drdoctor, center.com. So center.com. You can go to my website, and you can send me I have my email on there as well.
So if you want to set up a telemedicine consult, he's able to do so.
Right.
But then if we have mutual patients on Guam, we can work together too, no problem. And I can help work with them on an integrative way. But you moved from Virginia to Thailand in this beautiful. I can see why you're here now. I was like, this guy's crazy, moving out in a rural spot of 2 hours outside of Bangkok. But seems like you had the life, and you're spending a lot of time with your kids.
Yes. That's the goal.
But what's next for you? Like, you have some plans for your
Yeah.
property, and what are you trying to do now?
So you know, like I want to. Well, we're launching the farm stay here, like or like what they call the homestay in Thailand.
Yeah.
So we have some 2 main units that we're renting out. It's probably within 6 months or so that we're going to be launching, and then we're going to be working with the local farmers.
Yeah.
So we're going to have a little bit of farmers market right here right in front of our house here. To sell like organic produce to local people, and then so maybe like later on maybe we'll do some you know, consult or something, you know, like collaborating with, you know, other the institution in Bangkok.
Yeah.
You know,
So maybe higher level
yeah.
IV treatments and things like that. But
Yes.
But yeah, I think this is a great venue that's outside of Bangkok, and then you're gonna start adding, like, I like your idea of bringing in different artisans that teach different crafts.
Oh
It's
yes.
like,
Oh yeah. That's
I don't
right.
know, different crafts, different cooking techniques.
Yes.
From the older generation teaching us
Yes.
and having it here. Because some of my worries, like bringing my kids to a little bit more outside of the hustle and bustle of Bangkok, is like, what is there going to be to do?
Right.
But I think it's just as important to be in a more relaxed state, somewhere where you can kind of recharge, reset from your busy, stressful life, right? But also you got to have some stuff to do for your
Right.
kids, or have something
Definitely.
you want to learn, right?
Yes.
So I think that's really cool. You're going to bring different activities, maybe
Yes.
cooking classes,
Local,
and
yeah.
new things to learn here, and maybe you have some other services, whether it's yoga or something, to reset. And then on top of that, you can make it like a medical retreat. So
Right.
yeah, I'm excited
Sounds
to
good.
that. So we might, you sold us. We might come back now.
Yes.
Come back here to visit you
Yes,
guys.
Yes, we would love to.
Yeah. Well, is there any last messages or?
No, but
No?
thank you for like letting me, you know, talk about naturopathic medicine. You know, I think we need to, like, some people need to know about this type of medicine. You know, you know, it's been around for many years, but not many people are aware of it.
Yeah.
You know, so thank you. Yes.
All right, we're gonna sign out.
Yes.